Hello everybody, Dr. Stryker. I'm here with our patient Lance, who we are treating for a sleep apnea problem with an oral appliance. And just to back up a little bit, for those of you who are not familiar with why would a dentist be involved with treating somebody with sleep apnea, until about 3 years ago, we were really not looking much at airways in our office, although I think we were airway friendly. We just didn't really look beyond the mouth into the airway. And so with new technology and things that we're looking at now, we've actually started looking a little beyond the teeth and beyond the roof of the mouth and saying, you know, there's something back there that's kind of important, and that airway is something that we can influence. So to get to Lance's case, he was diagnosed with sleep apnea, and we've been treating him with an oral appliance to open the airway. And so, Lance, let me ask you, how long have you been wearing the appliance now? How long has it been?
I think about 6 months.
About 6 months. Okay, gosh, I didn't know it had been that long. So can you tell us a little bit about, you know, where were you before and what the appliance has done for you, what has changed for you?
I just happened into it when the girls came over and spoke to us at Rotary about the option. I didn't know there was an option other than the breathing machine, but I was at a point where I couldn't hardly function during the day. I would sleep every opportunity, and my sleep, I could tell, the quality was getting less and less all the time. So I checked into this and just decided to take a chance on it, and it has been a life-changing thing.
So you actually had the CPAP?
No, I did not.
You did not, okay.
But I just saw that it could be a pretty inconvenient appliance to use.
Yeah, and for those of you who are not familiar with the breathing apparatus, the CPAP, many of the patients that we see, once they're diagnosed, just realize either they can't tolerate it or they've tried it and they can't tolerate it. So in Lance's case, it was just a decision he made even before trying it. That wasn't going to work for him. Fortunately, the oral appliance was something that he could do. So overall, what would you tell somebody, Lance, if they were considering, maybe they're having difficulty with a CPAP, or maybe they've decided that's just not for them? What would you tell them?
I think it takes away most of the negatives about the machine, as far as allergies, the inconvenience of hoses and wires and so on and so forth that you have to deal with that. It's worth taking a chance on. It's just a simple thing that fits in your mouth at night. After a few days of wearing it, any adjustment to it is pretty well gone, and it's the most wonderful invention ever.
Great, great. You know, one more thing too I want to comment on though, and a lot of patients are reluctant to seek out this care as they're worried about going in to a sleep lab and sleeping in a funny place. One of the things that they're not aware of is the fact that we actually can do a home sleep study. And you know, the folks watching this might want to see your appliance and how it fits in the mouth too. So,
Yeah,
you mind
okay.
showing them that?
Nope, not at all.
Goes
It's
in
pretty
pretty
simple.
easy, yeah.
It's molded to fit your top teeth and bottom teeth pretty snugly, so it stays attached to them all the time. It's got adjustable straps here. The idea is to pull your bottom jaw out and hold it out in the evening, so your throat, your airway won't close up. So these straps are adjusted as you adjust your jawbone movement at night. You can shorten them up, and it pulls your jawbone out to open your airway up a little more every night until you get to the point you're satisfied. It's got rubber bands just to kind of help hold it closed, but it's real simple. It's just like any normal mouthpiece. Place it in like that. You can breathe, talk, take pills, whatever. It's real easy to take in and out. It's not bulky. There's a little bit of a hinge on the side that you kind of have to get used to inside your jaw, but it's not inconvenient at all.
Great. Well, Lance, thanks for sharing your story. I know it's going to help a lot of other people, so
You're
appreciate
welcome.
you being here today.
Thank you very much.
You bet.